Bam. Welcome, everybody. I think we're close to 400 attendees tonight already. So thank you all for joining us tonight here at Center for Brain Health. We welcome you. I know some of you are in the middle of the heat wave, so hopefully you're in someplace cool to enjoy tonight. I have the pleasure of introducing Jennifer Zients, who is our Deputy Director here at the Brain Performance Institute. I'm going to tell you a little quick story about Geoff because Jennifer gets to introduce Geoff, but Geoff Ling is one of the reasons I'm here in Dallas. When I first spoke to Geoff, I was sitting outside of Smoothie King in San Diego. I was consulting for a med device company there, and Geoff pretty much sold me, along with Dr. Chapman, on why brain health was the next big thing. And he was so amped up about it. So I'm really anxious to hear Geoff's discussion tonight about being left of boom, and proud to have Jennifer and our team leading us here at the Brain Performance Institute and leading all of our clinician teams. So I'll turn it over to you. I'll have a few comments at the end of the event. Thanks so much.
Thank you, and welcome everybody. We are thrilled to have you guys all here tonight with us. For those of you who are new to SIPS and Science, welcome. And for those of you who, this is old hat, welcome. We're so excited to have you all. SIPS and Science is an initiative out of the Center for Brain Health to help bring scientific discoveries and advances to the public, to make it accessible so that we can have good conversations, stimulating conversations, and engage the public. So we are definitely looking forward to your questions that you have tonight. Please use the Q&A. The chat, we don't have a chat, but we've got Q&A, and we'll be having some questions with Geoff in toward the end of the night. So I am so thrilled to get to introduce Dr. Geoff Ling. Dr. Ling is a world-renowned neurologist, a researcher, a subject matter expert in traumatic brain injury, a retired Army colonel, an alliance builder, a visionary, and even a fly fisherman, believe it or not. He has a broad-based expertise in cognitive neuroscience and technological advances. And if I read you his entire bio, that's what we would be spending our night doing. So I want to give you just some highlights. He's board certified in both neurology and neurocritical care. He holds appointments at Johns Hopkins and at the Uniformed Services University of the Health Sciences. He was director of DARPA, Biological Technologies Office at DoD, where he championed the development of responsive brain-controlled artificial limbs. And that's the first time I got to meet Dr. Ling, was when he came to the center to talk about his work at DARPA. So it's been many years now, Geoff. He is acting vice chair for research at Inova, which is a non-for-profit healthcare system out of Northern Virginia. He serves on the board and advisory councils of many national organizations that are focused on the brain. And true to form, he is one of the co-leaders of the Center for Brain Health's BrainHealth Project. And it's his vision and Dr. Sandy Chapman's vision to have this audacious goal to help double our brain health and double our brain performance. And so super excited to have you tonight, Geoff, to get to talk about left of boom and how that's important and why it is so important and how we get that. So tell us, let's start off. Tell us how you got involved in this, and let's start rolling. And especially, I think, tell us, having this whole background in medicine, diagnostics, treatment, how is it that you also see the importance of prevention, protection, and resilience building? Let's start with that, and then we can kick off.
Thank you, Jennifer. This is it's wonderful to be here. We're seeing all my Texas friends again, and although I'm not there to be there down with you guys, judging by what Steve said about the heat wave, I just assume stay up here in Maryland. So all good, all good. So one of the big questions always is, what is left of boom and why is it important? And that's pretty much what gets to what you were asking, Jennifer, is what is left of boom, and in fact, how in fact does it play in this discussion that we're going to have today. Left of boom is a term that actually came out of the military, and really what it means is boom, as you guys would know, would be an explosion. That's what it would be. It'd be an explosion. It'd be the event, the seminal event. And if you're right of boom, it basically means that, unfortunately, the event has happened, and now you're responding to it. If it's an explosion, such as in this chart here, which came out of the military, what you're doing is you're reducing the impact of a successful attack. It's your medical response. It is FEMA. It is the military now setting up a guard perimeter and blah, 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 blah. But sadly, it means a whole bunch of people got hurt. That's really what it meant. And you would like very much to stay to the left of the boom. And how do you stay left of boom? You try to identify your threats. You try to identify the vulnerabilities. You try to develop prevention measures, intelligence, and all those things that was military. But this is very applicable to medicine as well. It's very applicable to the conversation we're going to have, because boom is when something bad has happened to your brain. You've had a stroke. You have had a psychotic break. You're severely depressed. You've developed Alzheimer's disease. All these things one wants to avoid. And really, you don't want to be in a situation where you are right of boom, because right of boom is where doctors like myself get involved. And our involvement in the situation of healthcare would be your treatment. Are there medicines that we can provide that would help? Is there surgery that we can perform? And another question is that, of course, is there rehab? And rehab would be restoration or replacement. Rather, you'd like to be left of boom. You'd like never to have Alzheimer's disease. You'd like never to have a psychotic break. You'd like never to have a stroke. And so what you want to do is you want to prevent. And so how do you prevent such things like this? Are there ways to prevent them? And the good news is there are. In fact, we do better left of boom than we do right of boom. Left of boom, we identify what we call risk factors. What are the things that increase your risk of having these terrible conditions? And if we know what those risks are, can we reduce those risks? Second, are there intervention methods? Vaccines is a very good example. You don't want COVID. Trust me, you do not want COVID. I have taken care of COVID patients in the ICU. You do not want COVID. COVID is best treated by never getting it. And so risk factors, we all know them. Close contact, being in a room full of other people who are potentially asymptomatic. So you wear a mask, and you stand 6 feet away from people. And that is it is very, very effective. Let's be honest. It's very, very effective. And you would say, but those aren't medicines. They're not. They're behavior modifications. And this is going to be a theme that you'll hear. Second, now there are vaccines. Oh, thank you goodness that there are vaccines. That's why we are not wearing masks right now, because vaccinations is very, very, very effective. Let me add another very, because it is the current genomic vaccines are over 95% effective. That is ridiculously great, ridiculously great. On an average good year for flu, you're lucky if you get 40% protection. Here, they give you 95%, and it is just awesome. It's not unlike aspirin. An aspirin a day keeps the cardiologist away. That's an old saying. There's no question at all that an aspirin tablet will reduce the risk of a heart attack. And the fact that that's a wonderful thing. I mean, how many medicines do you know that are as effective as aspirin, reduce the risk of heart attack by over close to 50%? It's actually about 49%, but we'll say 50%. And you can buy it for less than a penny in a Piggly Wiggly with a coupon. Now, wouldn't you love to have a therapy for COVID that you could buy with a coupon at Piggly Wiggly? So here we go, really successful. Can we, then you say, well, that's all heart stuff, Geoff. Are there things you can do for the brain? And the answer is yes, resounding yes. One of the reasons that Jennifer had asked me, how did I get involved with this group? It is because the Center for Brain Health has been a pioneer in the left of boom for brain. When Sandy Chapman was in kindergarten, she founded the Center for Brain Health in the late 1990s. And it has been a leader in this field. Other universities are involved. We're not going to say it's the only one, but there's no question that the center has been a pioneering institution. That, with the other work of other institutions, has really given us rise to an understanding now that we can actually do things to say left of boom. Because when we go right of boom today, in the world of neurodegeneration, Alzheimer's disease, Pick's disease, multi-infarct dementia, treatments, there are none. Let me say that one more time. There are none. As far as rehab and restoration, sadly, for Alzheimer's disease and neurodegenerative disorders, there really is not much you can do. And it's really a sad situation. So in this particular case, I think of Benjamin Franklin when he so wisely wrote back in Poor Richard Almanacs, an ounce of prevention is worth a pound of cure. And I would add a caveat to that. It's worth a pound of cure if there is one. And in the situation that we're talking about today, sadly, there are no cures. So it is crucially important to stay left of boom. Does this idea really, really work? It sounds neat. It sounds good. But does it truly work, this left of boom idea? And the short answer is yes, it does. Yes, it does. I think the best example is something called the Framingham Heart Study. The Framingham Heart Study was an early study that was funded by the National Institutes of Health back in the early days, right after World War II. And it was launched in 1948. And it's right, Framingham is a town outside of Boston. And people think this is a Harvard study. It's actually not. It's a Boston University study, much to the chagrin of Harvard and much to the chagrin of also Boston U, because nobody gives them credit. So let me give them credit. It's actually a Boston University study, okay? So the other school in Boston. So, but the BU epidemiologists launched this really neat study. And what they did was they took a large cohort of males, white males, because it was in 1948, and they decided to study them and look at them longitudinally. In other words, they enrolled them in the beginning and followed them out. And what they did was they were looking for things that were related to heart attack. What were things that seemed to be related to heart attack? And the question is, were they causative or correlations? They didn't work that out then, but they did ultimately. But anyhow, so they went ahead and enrolled a bunch of these folks in there, which was great. And they followed them. And you have to understand, this was in 1948. I mean, a lot of these people didn't have phones. So they were going door to door. Folks like Jennifer would be going door to door with a clipboard and interrogating these people on a regular basis. But it was a tremendous study. The impact of this one study was unbelievable. They went by following these folks, and by the way, the study is still ongoing. They learned a lot of really cool things. And the most important thing they learned were there were indeed risk factors. Some risk factors you can't modify. Being male, well, I suppose you could modify it, but you know, that kind of surgery I think is left for very special circumstances. Age, well, none of us are going to get younger, so that's too bad about that. So none of us are going to get younger. So being male and age over 55 are two risk factors, but they're really not modifiable. There are modifiable risk factors that follow: hypertension, that is high blood pressure; cigarette smoking; high cholesterol; high lipid; excessive alcohol use; cocaine, drug and IV drug abuse; physical inactivity; and oral contraceptives. All of these things were tested to see if they were cardiovascular risk factors. And surprisingly, one thing was found not to be. Alcohol use was not found to be a risk factor for cardiovascular disease. That was an astounding finding. And so that tells you that it was really a fine study, because they were able to identify something that everybody took for granted as being a risk factor and found out it's not. However, the others were. And then what they did, after finding out, after 10 years of study, the first 10 years of study, finding out all these things were critical, you say, well, what do I do with it? What do I do with this information? I mean, now I know something, but what do I do? They created what they call the Framingham risk score for cardiac heart disease, all right? Cardiovascular disease. And what happens is you describe the point score. And in fact, doctors today still use the Framingham risk score. And what they look at is your total cholesterol level. And as you can see here, you get certain points to it. What your systolic blood pressure is, that is the high number of your blood pressure. They look whether you have diabetes, whether you're a smoker, what your HDL, blah, blah, blah. And they add it all up, and then they use this nomogram, and they can find out if are you in the low risk group, which is green, obviously, or are you in the high risk group, which is in the red, obviously. And if you're in the high risk group, can you get to the low risk group, you might add? Oh my goodness, I'm in the high risk group. I don't want to have a heart attack. So what do I do? Well, you reduce your blood pressure. And in fact, if you can get your systolic blood pressure less than 140, you actually see an almost 40% reduction in risk of a heart attack. That is huge. That is not little. That is big. That is a 40% risk simply by lowering your systolic blood pressure to less than 140. What about cigarette smoking? Quit. It's a real simple thing. It's a 4-letter word. Quit. Cigarette smoking has no place in the modern society. Because if you are a smoker and you quit smoking, It'll take you about 5 years, but if you are very disciplined and don't smoke, you'll reduce your risk to that of being a non-smoker. And that's a good thing, as well as having, COPD, chronic obstructive pulmonary disease. You don't want to have those things. You don't want to have those things. Emphysema, that's emphysema. You don't want emphysema. So smoking not only reduces the risk of emphysema, clearly related, it also reduces your risk of having a heart attack if you quit. Diabetes. Diabetes is a big one. If you, in fact, have diabetes, you have to treat it for obvious reasons, and you have a very high risk of having a heart attack. But if you can control your blood pressure to be less than 130, actually, in terms of management, less, so it's a little more aggressive than non-diabetics, you'll actually get a 44%, same as the other group, the regular group, the non-diabetic group, a reduction in risk. And if you're on a statin, you can get additional 50% reduction. So really just tremendous. And lipids, same thing with lipids. If you can drive your lipids down, you get a 30% improvement in your risk of heart attacks. These are all big numbers. So managing, and also if you think about it from a composite, if you have high blood pressure, you're a cigarette smoker, you have some early signs of diabetes and your cholesterol levels up, if you go after all four, you can actually get control of them and get control of your heart attack risk. And that's a wonderful thing. That's a wonderful thing. These are the guidelines, in fact, that come up and shows you what they are. So what ultimately does that mean? I got control of my cholesterol. I got control of my diabetes. I did all that stuff. What does it mean? The good news, it means you're going to live longer. By golly, you're going to live longer. Take a look at these numbers. In 1960, now remember, the Framingham study was started in 1948. And over the first 10 years, they got a lot of insights on the things I just talked about. And then, of course, they had to be introduced into the lexicon. So the awareness of cigarette smoking, the awareness of cholesterol, the awareness of blood pressure really wasn't around in the 1960s, the time of your grandparents, right? For some folks, and the time of their parents and some people like me. Wasn't aware, but I will tell you, there's very few people today who don't know the importance of managing pressure, sugar, and cholesterol. Very few people. And we've seen the fruits of that. So in 1960, when the life expectancy was about 68 years old, that's when a lot of this stuff started coming out into the public awareness. 1948, the study started. 1958, the first 10 years were done. They gathered this data. They started publishing it. They were starting to educate doctors. Doctors were educating their patients, and the beat goes on. But look at this. As more and more people got aware of it, the life expectancy went up. Because if you didn't have a heart attack, you weren't dropping dead. And if you weren't dropping dead, you were alive. And that's an awesome thing. So if you look at the steady drumbeat of getting aware of cardiovascular risk factors and jumping on them, we now have today a life expectancy of about 78 years old. Now, if you went, that's 10 more years of life. 10 years of life. That's a good almost 15 to 20% additional life. That's an awesome thing. What are you going to do with an additional 15? And this is not just 10 to 15 more years of life, just survival. Actually, the quality of life, because your cardiovascular system is good enough now, it is not unusual to see a 70-year-old at the gym. Back in the 1960s, it would be astounding. But now, how many of us have seen 60 and 70-year-olds hiking on trails in the national parks? How many of us have seen them at the gym that we go to? How many of us see them skiing or dancing or doing other things that everybody takes for granted? A lot. And that's a good thing. So it's not just that you've got more years of life, you've got more years of quality life. And the things that you can do, it's really awesome because the older folks have wisdom and they can impart that to everybody else. And this is great. But because of the cardiovascular benefit, look at the projection of the United Nations and World Health Organization's projection. They believe that by the year 2060, which is not that far from now, by the way, life expectancy is going to exceed 90 years old. And I would also argue that knowing this number, the person that will live to 120 has already been born, And we're going to continue to go up, up, up in terms of this. Why? Because the young people know to exercise. The young people know not to smoke. the young people know to watch their sugar and their blood pressure. An old broken down Army colonel like me didn't know these things. And so I started to act on them much later in life. Jennifer, who's a young spring chicken, when she was in college, she was doing all these things. So she'll reap the benefit to live the 90s plus with good health. And that's a wonderful thing. But is there a downside? Yes, the longer you age, your risk of Alzheimer's and the other neurodegenerative disorders goes up. That's a sad fact. That's a sad fact. Our brains, when was the last time anybody on this line did something for your brain? Consciously. Now, many of you already do because you have good social networks. Many of you do because you continue to challenge yourself cognitively by reading, for example, by listening to music, for example, by doing art, whether it's the performing arts or the visual arts. It doesn't really matter. The fact that you do those things are positives, and Dr. Chapman's work here at the Brain Center with Jennifer's work has demonstrated the power of those things. But I'm not going to dwell on them as much as we don't right now consciously do those things to improve our brain health. We consciously go and jog every day. We consciously go and walk every day. We consciously moderate our intake of fats every day and sugars every day because we are looking to protect our hearts. But we don't do that for our brains. Not yet. Not yet. And you would just say, well, why don't we do that? And I think it's because we're still in the dissemination of knowledge phase. We know a lot. The academic medical literature is replete with the information to show you what you need to do for your brain. It's there. But now, because of dissemination of information in a way that everybody would know, much like everybody here knows that high blood pressure is bad, diabetes is bad, there'll be other things that they'll know are bad for brain health as we do for cardiovascular health, and you will then do something about it. Will it require some modification of lifestyle? It most certainly will. Will it require taking medicines? Maybe not. Maybe not, because there isn't one now. So isn't that a good thing? Nobody has to cut on your brain, and you don't have to take yet another doggone pill. All you have to do is do some minor lifestyle things. And that's, in fact, what the BrainHealth Project is about. And we'll come to that later. But living longer does, unfortunately, right now, increase your risk of Alzheimer's disease. For every decade over the age of 70, there's a significant increase in the risk of Alzheimer's disease. The numbers vary a little bit, but it's about 10% per decade. So, and that's quite a bit. So by the time you hit 90, you may actually have a 30 to 40% risk of having Alzheimer's disease. That's not good, because you don't want to live to 90 drooling on yourself, looking out a window and wearing a diaper. What you want to do is you want to be 90 and go dancing, and you want to go out and go hiking, and you want to do all that, and you want to interact with your family. You want to do all that cool stuff. And what I'm suggesting is, by staying left of boom with the things that are coming out of the community of cognitive neurosciences now, such as at the University of Texas Dallas and the Center for Brain Health and other places, that we will be able to intercede. And no time is too soon. No time is too soon. The reason why I will likely not live to 90 is because I didn't do all the good things I should do for my heart. The reason why Jay-Z is going to live to 90 and still climb Mount Everest is because she started when she was in college. And that's really a fact. I mean, I'm not getting the benefit because I started later. I am getting benefit. I'm not dropping dead at 64 because I'm older than 64. I'm not so sure. I wanted to say 66, which is the average age, but a lot of things can happen between now and then. So we won't jinx myself on that. But the fact of the matter is that I want Jay-Z to do the fun things in her life when she's 90 and not be consigned to a nursing home because she has Alzheimer's disease. And Alzheimer's disease is a real deal. Everybody knows what it is. It's a real deal. About 1 to 2% of the population today, right now, suffers from known Alzheimer's disease. About 6 million people, which is about 2% of the population. And look at these numbers. They go up dramatically as the years advance. And so this is something we have to be aware of. But is Alzheimer's, and of course, we know that, as you can see from the projections, it's going to keep going up. This is the CDC and the NIH. The NIH, National Institute of Aging, and the Centers for Disease Control, as well as Medicare and Medicaid, have all shown very similar numbers, that over time, we expect more and more burden of Alzheimer's disease, largely because our population is aging. And that's really what it comes down to. All right. So is that the only thing we worry about? Actually, no. There are other diseases in addition to Alzheimer's that we worry about. Parkinson's disease is one, a treatable disease. It is a treatable disease, but it's most of the motor part of Alzheimer's, of Parkinson's we can treat. Parkinson's-related dementia actually doesn't respond so well to the therapies. So we really want to do it. You do get some, but you don't want Parkinson's disease. Just leave it at that. You don't want Parkinson's disease. And there's also other degenerative disorders like Pick's disease, multi-infarct dementia, and I can go down the list. But all of them are associated, Lewy body's disease, these are all associated with dementia, and you don't want that. But what's the good news? The good news, though, we have identified risk factors for neurodegeneration. We have done that. And the work that at the Center for Brain Health has really been a leader in this. Age, for example, we know has potentially the greatest risk, as it did for cardiovascular disease. Not much you can do about that other than try to keep yourself young in mind and spirit. However, we know that high cholesterol, high blood pressure also play a role. So does diabetes, by the way. And that's because of the multi-infarct dementias. The multi-infarct dementias are clearly related to vascular-based diseases, that is blood vessel-based diseases. Your coronary vessels, your cerebral vessels, your peripheral arteries in your legs, they're all blood vessels. They're all impacted by the same thing. So by treating the heart, you're essentially treating the brain. And that's a good thing. So if you adhere to the guidelines for cardiovascular disease, you're going to get some benefit for cerebral, that is brain disease as well. All right. But what else is there? Well, we find out that low education actually does increase your risk of Alzheimer's disease. So going after an advanced degree, going after a bachelor's degree, for example, reduces your risk of Alzheimer's. Getting a master's degree reduces it even more. Getting a doctoral level degree reduces it even more. And continual lifelong education actually is shown to be beneficial. So those of you who like to read, those of you who love to go to the opera, those of you who still like to play the piano, even though your mother tortured you when you were a child, but now you do it, this is all good for you. All good for you. Social isolation is a bad thing. Humans are social animals. COVID has shown us the crazy things that can happen when you confine people. But it turns out, and this is the work that again came out of the Center for Brain Health, that in fact, having a dense social network, being active in your church group, having an extended family that you work with, being among friends, particularly in person, is all ameliorative when it comes to reducing the risk of a neurodegenerative disease. So those are some simple things, and there are more things, and we'll go over them later, but those are things that we now know are clearly related to a risk of neurodegeneration. And as I said to you before, we want to stay left of boom. We do not want to be right of boom. Right of boom right now, Alzheimer's disease, there is no treatment that reverses the dementia. You people have heard of the new drug that came out, aducanumab or Aduhelm, that the Biogen just released. And there is a huge controversy about that. And why is that? Because there's no question that that drug reduces the amyloid, which is the pathological clumping of the protein in the brain that seems to be associated with Alzheimer's disease. No question that aducanumab reduces that burden of clumping, but it has yet to show that it actually improves the dementia. So this is one of those situations where you can make an X-ray look better, but you can't make the patient look better. So again, sadly, we don't really have a treatment, in my mind, that is going to help us reverse dementia as much as we would like. Pick's disease or frontal dementia, frontal temporal dementia, there's no treatment. Multi-infarct dementia, there's no treatment after it happens. After it happens, you can do a lot to prevent it by paying attention to your blood pressure, cholesterol, and all that stuff. Parkinson's disease, there are treatments. They do provide some benefit, but let's be clear here. It's not a cure. It's not a reversal, full reversal. And Lewy body's disease, which is another thing that's very closely related to the Parkinson's disease. Those are the 5 major neurodegenerative processes. And sadly, it shows you clearly want to stay left of boom. So what do we do? And I would say this: cognitive activity, cognitive training. Now, it's not just doing crossword puzzles, but because if you do a lot of Sudoku and do a lot of crossword puzzles, you'll get really good at doing Sudoku and really good at crossword puzzles, but doesn't mean that you're going to forestall neurodegeneration, sadly. There are some broad-based things that you can do, and that's what the Brain Health Project is about. is what are the broad-based things that we can do collectively. Doesn't cause medicines, doesn't require surgery, but something that we can add to our daily routine that kind of is just good for our brain. As much as you like to walk, why can't we do some walking for the brain, as it were? And there are things that we can do. Physical exercise definitely helps. There's a lot of benefit you can have from physical exercise. Healthy diet, of course, helps. It helps with the cardiovascular, and it will help with your cerebral vascular, and it will also help with your brain. Proper sleep is really a big deal. That is not a little deal. That is a big deal, right? In the old days, many of the folks here who played sports remembered when they got a ding in the head, they got a concussion, the coach would say, shake it off and go back in. That was singularly the stupidest thing that they could possibly have said to us back in those days. But they didn't know any better. They didn't know any better. But, but my coach who told me that, I like to go and kick him in the rear end because that was the stupidest thing you possibly could say. The same thing is you are weak if you sleep, that you should be working round the clock. That shows that how dynamic you are. You're type A. That's a great thing. That is a stupid thing. You need to get proper sleep. Proper sleep is 6 to 8 hours a night. End of story. You don't get proper, that's the easiest thing you can do to help you reduce the risk of Alzheimer's disease. If you want Alzheimer's disease, good, stay up all night. But if you don't want Alzheimer's disease, do your best to get your 6 and 8 hours of sleep. That is really so simple. I'm telling you as a doctor, get some sleep. That's a good thing. You should be happy about that. Social engagement, absolutely. Do not be a hermit. Get out there, engage with your friends, and not just, over the phone or texting, but get out there, engage with your friends. Be active in your community, be it your church community, which are wonderful things. Your community, being active in the Y, volunteer work, all those things are super, super beneficial, not only to yourself, but to society. It's a good thing. It's a great thing. So those are simple things that you can do. Soon you'll be introduced to what the brain health programs will be. These are things that we can put now on a cell phone, and you can do it standing online at the grocery store, but do something for your brain. You do it for your heart, do it for your brain. So that's about where I want to leave off right now, and so we have time for discussion. But the good news is right now, you're going to live forever. I'm telling people on this audience, you're going to live longer than your grandparents did. I can promise you that. You're going to live longer than your parents did. And your children are going to outlive you. And that's a good thing. But let's make it a quality of life. Let's let it be a quality extension. And that means taking care of your brain like you do the rest of your body.
Thank you, Geoff. I always love, if you don't walk away with massive take-home messages and a call to action from Geoff, then something's wrong. He is amazing. And I really appreciate all the messaging. I've got a question first. I think it's interesting.
Jen, before you do that, Geoff, can you take off your screen share?
Oh,
Just
yes.
stop sharing your screen, and then
there you go.
Thanks.
Thank you.
Okay, so I love how the Framingham study, certainly. Left of boom, I think, is well known, understood, and respected, even if people didn't call it that, around heart health. And the importance of awareness, education, and treatments, kind of things that we can actually do. We see in my own family, we saw the massive impact of this kind of research where kind of what you're talking about in the early, in the 1940s, early 50s, my grandfather dropped dead of a heart attack at 40. And then my dad had his first heart attack at 40, but lived 26 more years before he had heart disease. But we all got the benefit of that because of awareness, education, and things to do. Brain is so much less tangible, I think, to people. And so I think there's stigma, there's ego, there's lots of I don't even know what to do. Like you said, there's lots of research that's coming out, but it doesn't get translated quickly enough. What is it going to take, in your opinion, Geoff, to get people to action?
Actually, it is all about awareness. Is about how can we share the scientific knowledge in a way that is both palatable and digestible to the regular person on the street. The regular person on the street, I would argue that to you I would point out to you the bus driver that just drove by the center probably 10 minutes ago knows about pressure, sugar, cigarette smoking. Doesn't mean they're entirely going to go after them. That's a problem, but they do know about it. That's the first major part of this battle. So the outreach programs of folks like at the center and the people who have benefited from the center is absolutely crucial. There needs to be a media campaign. We can take a lesson from the playbook of the American Heart Association. The American Heart Association has been very, very effective in get with the guidelines. First, they went after the providers, and not just the cardiologists, The cardiologists, God bless them, were the ones who led the charge. But they got it out to the primary care providers, to the nurse practitioners, and to, of course, your internists and your family practice doctors. That's the point of the spear. Those are the at the very, very edge. When they start adopting the practices that for brain health as they were for cardiovascular health, then you're going to start making some inroads, and then you want to have a large public campaign. And it's actually easier in 2021 to do this than it was back in the 1960s. They barely had televisions back in the 1960s, and now we have social media. So honestly, it's incumbent upon centers like the University of Texas Dallas Center for Brain Health, the University of California, Berkeley, Harvard University, Hopkins, who are all part of the leaders in this movement, I would say, to get the word out. Start first with the providers, then quickly go directly to the public and let them know that there are simple things they can do. Because, we know the heartbreak of Alzheimer's. Alzheimer's doesn't affect just the patient. It devastates the family. And so you want to be able to prevent this horrible disease because of the great impact it has across the board. And so I think people fear it. If you were told that you had Alzheimer's disease or early Alzheimer's, it will scare anybody, and you want to try to avoid it. And right now, and if you have it, God bless those people, you want to slow it down as best you can. So the things that are coming out of the Brain Health Center, the Center for Brain Health, and other places like it are critical over the next 5 years. We've known so much. We've known so much since the late 90s when Sandy started the effort. And the pioneering effort, she and Mark Mersnick and a few of the others started this movement, that we're not starting from zero. That's key. I think the next big thing we have to do is get the message out. And by the way, the Brain Health Project is going to help tremendously. Nothing like evidence. Scientific evidence is irrefutable evidence. And the Brain Health Project will go a long way in doing this, because it's putting it in the context of how the average person can take this knowledge, embrace it, and make it part of their daily life. That's what this Brain Health Project is about. It's a living project. And, Jennifer, I'm not going to steal from your thunder, because Jennifer is one of the architects of this project. But the key thing is, this project is a Framingham study, but it's the Framingham study in the 21st century, not the 20th century Framingham study. This study is not going to be just, males or white males in northern Massachusetts. This is going to be, encompass all genders. It's going to encompass all ages. It's going to all ethnicities. I mean, this is very important to do. If you're going to do it, you're going to do it right. That's why it's such a big study. But this alone could have such a huge impact on quality of life. Let me say quality of life, that it is going to be a landmark. There's no question about it. Framingham was a landmark. Look what it did for living longer. Now we're saying living longer, living better. That's what the better part is, the Brain Health Project.
Yeah. And we can put up a slide at the end that has a QR code so that people you can use your phones to learn more about the Brain Health Project, to enroll, or just to get some more information on it for all of you who may be wondering. So we will do that toward the end. Geoff, I know Steve's got some questions, but another question a couple people have been asking this is, so what are some suggestions for left of boom to do cognitively, to stay left of boom?
So, you can break it down into the areas that you want to do. So strategic thinking is an example, right? So it's not just doing crossword puzzles and Sudoku, right? I mean, because those teach you skills that are applied to a specific task, that is doing a crossword puzzle. If you want to do things for strategic thinking, there are certain exercises, I'll call them, that you can do. Jennifer, you teach them, So there are some things for like memory. You can actually teach yourself that. rationality. You can teach some of these things. So we know enough now about what is mindfulness, because the brain is an organ, but the brain, so the heart is an organ also, but the heart does one thing, pumps. That's it. Pumps blood in, pumps blood out. That's all it has to do. Doesn't got to do anything else. Pump, 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 right? The brain, on the other hand, has got to do so much more. And one of the reasons why it's lagging behind heart in terms of our knowledge of how to keep it healthy is quite honestly because of the complexity of what it does. You are who you are because of your brain. It is as simple as that. If I took your heart and I put it into Steve, and I put Steve's heart and put it into you, you would still be Jay-Z, he would still be Steve. If I switch your brains, well, that's going to be another more of an interesting finding, right? So, but the reality is Steve will now be in your body will now become Steve, and Steve's will now become yours. And that's a fact. So it is. So your brain is you. Wherever your brain goes, is where you go. And what makes you special is your brain. And in our 21st century now, what makes somebody successful is their brain. Let's be blunt. Let's be blunt. It's not the strongest who is successful. It's the smartest who's successful. Even in football, you watch football, these people are amazing athletes. Trust me. I mean, I work with the NFL. You guys know that. And the NFLPA. These people are amazing athletes. But the best of them are also the smartest of them. Tom Brady is not a dummy. Make no damn mistake about that. Drew Brees is not a dummy. They're really super smart people, but they're amazing athletes. Tiger Woods is no fool. He is a smart man, and yet he's also a great athlete. The reason why he's at the top isn't because he hits the ball the farthest. We know that. He hits the ball the smartest. So again, it comes back to, but what part of their brain is doing that? Is that memory? No, it's actually not. Strategic thinking, some of it, and other elements of it. And you do have to have memory. So when you do these things, that's what the Brain Health Project is about. Is it a compilation of things that you can do proactively to help your brain? And the answer is yes. And for me to tell you all the nuances that it doesn't help you, I would suggest that you do what Jay-Z said. When you see the QWERTY code, scan it, go through it yourself, and you'll see what we're talking about.
Great. Thank you. Okay, one more question, because I think this is another thing before Steve goes. I love how you're saying it, but some people, I think also sometimes what makes it feel like it's intangible is like this seemingly inevitability that if I have these genetics, or if I have it's going to happen to me. I have this family history. Somebody pointed out, like here we have President Reagan, who seemingly did all these great things for his brain and yet still is diagnosed. So can you talk about that? Just kind of this perception or this idea, genetics and the inevitability.
Right. So it's not inevitable that you're going to have a neurodegenerative disorder. Let's be clear on that. Not inevitable that you're going to have a psychotic break. Not inevitable you're going to have severe depression. That's not inevitable. We already know that. Families that have long history of these things are going to have to intercede, granted, but they, just like in your own family, clearly there was a history of cardiovascular diseases. And right now, thank goodness, I would guess that the males in your family are not having heart attacks at 40. And that's a good thing. It tells you right then and there, clearly it's not all genetics. Alzheimer's disease, only about 5% of Alzheimer's disease cases, by the way, seem to have any kind of genetic relationship. 95% seem to be what we call sporadic. So the likelihood of it being a genetic running through your family is actually fairly low. And if there does seem to be a high preponderance in your family, it may be because of some of the things that we're talking about, behaviors, diets, all these kind of things kind of come together. And so what I'm saying to the folks out there is, just by the numbers alone, that there is lots of room for preventing the quote unquote inevitable. Back in the early 1900s, it was quote unquote inevitable that somebody was going to have a heart attack. When were you going to get your first heart attack? That was the old saying. Now it's not an expectation at all. There's a good expectation you go throughout as a male that you'll go throughout your entire life and not have a heart attack. That's a good thing. Same thing with Alzheimer's. I will bet you dollars to donuts. When we start doing these interventions, we're going to get to the point where people are not going to see it as inevitable anymore. They did that one time thinking heart attacks were inevitable. Make no mistake about it. But now that's not true. Same thing for the neurodegenerative disorders.
Thanks, Geoff.
And the mental health disorders. Let me be clear here. I focus on the neurodegeneratives because I'm a neurologist, but a psychiatrist can tell you the same thing that I'm saying. A lot of the mental health issues is a reflection of brain health as well. The better your brain health is, the likelihood of your risk of suicidality, your risk of drug overdoses, all those other things actually goes down. So this is a good thing.
Right.
Geoff, I want you to riff on that a little bit, because one of the things, we're talking about as we come out of COVID, and we have a multitasking society, and stress is at a higher level than we've known. Talk a little bit about what brain health does with stress and how that affects you overall. You're the doctor, I'm not, but tie that together for the group.
Well, we know that stress itself, severe stress, undue stress, can be very, very deleterious, not only on the brain, but also on the heart. But really what we're talking about with the multitasking is attention, right? And a lot of people think that when they multitask, let's say they're doing 3 or 4 things at the same time, they're actually paying attention to 3 or 4 things at the same time. They're not. They're actually not. They're actually only paying attention to one thing for a very small amount of time, transition to something else for a very small time, transition back to something else small time. So they're actually very ineffective. In fact, one of the things you can do is declutter, right? Declutter. That's one of the things that it goes in with when you teach good brain habits. All right, I'll use that. Good brain habits is to declutter yourself, is that multitasking is not a positive. It's actually a real negative. And that, in fact, it is misperception that you're getting more done. You're actually getting less done and less efficiently done. And so, and it does have a negative impact on your brain health, because your brain health, now that you're basically overtasking the system, and that is in fact very insidious. And again, it comes down to education. It's telling people that this is not a positive. The fact that you multitask is not a good thing. Just like, having a thick skull and you can take a hit. Remember that, Steve, when a kid? Oh, he could take a hit. Now, Jay-Z as a mother would say, that's the craziest thing I ever heard, right? So it's like this. Oh, I can multitask. I can do 10 things at once. And I'm hoping that one day people say is, why are you doing that? Why would you let your child do that? And it's really the same kind of thing.
I took a lot of hits, so we'll see how that. My brothers used to throw me off the roof for fun when I was a kid. So that times change. One other thing that's really important, Geoff, is not only is there a stigma around brain health and mental health, but people hear about brain research and it scares them. So can you tell the audience a little bit about what interventional research is and why the BrainHealth Project is not something to fear? It's actually something to empower you, because I don't think people get that when we ask them to help with research. It's not a drug research. It's nothing like that. Can you walk them through that distinction?
Yes, absolutely. So a lot of times when people think about medical research, they're thinking strictly in terms of intervention. Am I getting a drug? Am I getting a therapy? Am I getting a surgery compared to somebody who's not, right? And does it make me better? And if it does make me better, at what risk? Correct? The nice thing about the Brain Health Project is there's no drugs involved. There's no surgery involved. The only intervention actually is, like you said, is empowerment, is learning things that one can do to basically have a positive impact on their brain health, right? That's really what you want to do. And it's founded on a lot of information. So there's not anything in this where it's going to be worse on your brain health. That has been taken out of the equation. The nice thing about the modern Brain Health Project as it's being executed is that it is a couple of things. In the old days, you would observe a disease process. So the first part of, like in Framingham, they did not do any interventions. They just watched. And what happens to you? And those who got heart attacks, how are they different than those who didn't get heart attacks? And that's where they came up with these different risk things, right? Oh, those guys had high blood pressure. These guys didn't. Those guys had diabetes. These guys didn't. And that's what they did. That is not what the Brain Health Project is. It's using 21st century techniques. So it's come a long way. Everybody gets brain health training. And then there are nests within it where your training is just a little bit different than Steve's training. And Steve's training maybe just a little bit different than Jennifer's training. And depending on which site you're at, if you're at the site that's in Boston, they have a little bit of thing in it. If you're at the site in San Francisco, it's got a little thing in it. But the overall foundational part of the study is the same. And so by using a nested approach, you're able to be sure everybody has access to the foundational work. And then these little things allow you to test, should this be added in or not? Should this be added in or not? And that's kind of like how this progresses forward. So the good news is whoever is part of the Brain Health Project is in fact going to have the benefit of at least that foundational training and all that other kind of good stuff. And then the little bit of nesting is not going to negatively impact them. We just want to know is that's something that's going to have such a big impact. It should be net in version 2.0 or 3.0 or 4.0. And that's a good thing. And so in this situation, because everybody is going to have a net benefit, it's very different than the old style of research where, oh, golly gee whiz, I'm in the placebo group and they're not going to do anything for me. That's not the case here.
Yeah, and that's why I just love your perspective, Geoff, because you're a doctor first. So you took an oath to do no harm.
Right.
I wanted the audience to hear, because that's not true in every other research. You're maybe sick. You already have a disease. You have cancer. I mean, there's so many. We're talking about keeping your healthy brains healthier longer. So do you see as a doctor any risk to anyone participating in the Brain Health Project?
No, not at all. In fact, I encourage people to do this. This is one of those things where you're going to have a benefit. You're going to have a benefit. And at the same time, while you are getting a benefit, you're also contributing to the next version because of the way these designs are studied. And that's a good thing. So not only are you going to help yourself, you're going to help the next group of people that come right after you. So the contribution of each subject is magnified. Each subject is actually doing something good for themselves and doing something good for the future generations. And that's an awesome thing. How often can you be part of something like that?
That's all I had, Jennifer. If you have a couple other questions, then I just want a couple of minutes at the end to wrap up.
You got it. I apologize. Our audience, we have lots of questions and we have lots of kind of personal questions that I'm going to try to hit on some that are more broad-based rather than asking Dr. Ling to try to give some more specific advice. So in general, supplements. People are always asking about supplements, nutrition. What's the state of the science, the research on these things for brain health?
So these are worthy things to look at, by the way. So I'm a big fan of looking at the influence and the impact of supplements. The only problem with supplements is that there is always a risk that they may actually make things worse. Anytime you take something by mouth or put it in your body, you run a risk that it might make you worse. But it also might make you better. That's why the supplements have to be studied in a rigorous way. You cannot rely on anecdotal evidence. Oh, I took this, it made me feel great, therefore you should take it. And all of a sudden your hair falls out, right? So this is not a good thing. So these things are being investigated in a rigorous way. The National Institutes of Health, God bless them, do have studies that are ongoing looking at things like ginkgo root, St. John's wort, things like that, right? Certain of the teas, herbals, but there's so many of these things out there, it's hard to do it. And I'll tell you what the biggest problem is in doing the research when you're talking about things like ginkgo or St. John's wort or any of these other things. And that is, they're not rigorously made the same. When you take a pill, aspirin, for example, or ibuprofen, it is aspirin, it is ibuprofen. It has to adhere to a certain standard. The Food and Drug Administration has very strict standards. So to do a study is very easy. You would take what I would take, easy, and then we take a look. Hard part about these supplements is that these manufacturers fight like the dickens not to be FDA oversighted. They don't want to be FDA oversighted. Make no doggone mistake about it. And they'll tell you all the good reasons why they don't. Oh, it's going to increase the price, blah, blah, blah. No, they don't want the scrutiny of the federal regulatory agency to say, no, if you have 100 milligrams of St. John's wort, you have to have 100 milligrams of St. John's wort, and it's got to be this level of purity. They don't want that. So they are considered to be foods. The supplements are considered to be foods. And the supplement you get at store X, website B, is likely, by the way, to be vastly different. Vastly different. So that's the hardest part. That's why, so in the NFL, we're trying to do a study on CBD. We're trying our best to do a CBD study. Same problem. I'm not a drug. I'm not a medicine. I am a food substance. But you need to take this because you're going to have a health benefit. You know, come on, seriously? And yet they don't when you try to look at the content of the CBD oil and these different preparations, it's all over the map. It's all over the map. It is hard as heck. So that's why you'll say, how come the government hasn't done really good studies? They're trying. They're trying. But once they do a good study and they say, okay, look, St. John wort seems to have a benefit. Let's just say it does. But does that mean that the St. John's wort you buy off of website A is the same St. John's wort that was in that study? And the likelihood of the answer is no. And that lies why it's a gamish right now. It's a gamish because those guys don't want to be oversighted. They don't want to be regulated. They want to be, here. I made it in my basement. Here, you take it. And that is bad science. That is bad science. And bad science is the worst science. So I want to warn folks that taking nutraceuticals, I think, is very important because I believe that many of them may have a beneficial part to them. There's no question. But I got to know more rigorously how much of it, what purity of it, and that when I take it from me, and I, let's say, prescribe it for a patient, it's the same. It's got to be the same. That's why the nutraceutical story is just such a gamish. That is not what we're talking about here at the Brain Health Project, because you're not taking anything by mouth, and everything you're getting is the same as the next person. The Curdy code that Jay-Z is going to put up for people to scan on, that's the same for everybody. Same for everybody. So when you're actually involved in a really well-disciplined study, they have control for all those factors, because when the results come in, you want to get what the people in the study got.
Geoff, thank you. Everybody, there are so many questions, I know, but it's also, we're almost at time. And so first and foremost, if your question wasn't answered, which is most of them, my sincere apologies. We had many repeat questions that we were trying to hit on. And I hope that at least this opened up some good conversation. You have things that you can take to talk to your physicians about, and that to do some more investigative research on your own, to be looking at things and exploring. Certainly the Brain Health Project is something to be thinking about. I think Steve's going to talk about that, and we'll put up the QR code if you're interested in getting more information or in enrolling. I think that one of the questions that came up, and I think this is what you're saying, Geoff, is, nutraceuticals. You said earlier about not having that pill, that magic pill, that there isn't one. Behavior changes and our lifestyle cannot be underscored enough. There is not a pill. There is no magic bullet. Nothing like this exists right now in our lazy society, where we would rather just take our aspirin to be heart healthy. We don't have that for brain health. And it's up to you and each one of us individually about, like Geoff said, what we care about, what drives us, what is important for me versus Steve versus Geoff. So I encourage everybody to keep the conversation going for yourselves and for those that you're close to. Explore, look for ideas, things that can be of assistance to you and benefit.
Yeah. So Caitlin, go ahead and put up that QR code if you have it at your fingertips. And Geoff, correct me if I overstate things, because you're the doctor. So I'm going to challenge this group. You heard from Geoff, you cannot hurt yourself by participating in the Brain Health Project. You can only benefit. The question is how much, and that's up to you. We are a non-for-profit, so we look for, easy ways to get people to participate in this life-changing endeavor, which is the Brain Health Project. Why wouldn't you do it? And let me give you a challenge. Not only do I want you to explore and learn more about it by scanning this code, but if you're so inclined to sign up, invite 5 or 10 friends and family to do it with you. Don't just do it by yourself. Start developing your own brain health community. Geoff talked about 2 things very important to me. My dad passed away from a heart attack at 52 when we were playing tennis. Genetics don't determine your livelihood, because I've now outlived my dad by 8 years. I walked my mom into an Alzheimer's facility. It was the last time she saw her home. I don't wish that on anybody. You can take control of your life. My view of what I can do with my brain has changed dramatically over the 3 years because of what I've learned. To Geoff's point, it was awareness. I used to say I didn't want to know about my brain because of the Alzheimer's experience we had with my mom. The Center for Brain Health completely changed that view. I can empower myself. I can start controlling my neural pharmacy, and I'll challenge you, it's easier than going to the gym. It's easier than taking a pill. So why not try it? I'm challenging you to do it. Do a little exploration, sign up if you're so inclined. Why wouldn't you? Thank you, Geoff. Thanks, JC.
Thank you.
Thanks, everybody.
Thank you, everyone. Good night. Thank
Night.
you.
Thanks for joining us.